COPD. Chronic obstructive pulmonary disease (COPD) is a chronic inflammatory lung disease that causes obstructed airflow from the lungs. Symptoms include breathing difficulty, cough, mucus, sputum production and wheezing. It's typically caused by long-term exposure to irritating gases or particulate matter, most often from cigarette smoke. People with COPD are at increased risk of developing heart disease, lung cancer and a variety of other conditions. Emphysema and chronic bronchitis are the two most common conditions that contribute to COPD. These two conditions usually occur together and can vary in severity among individuals with COPD. Symptoms. COPD symptoms often don't appear until significant lung damage has occurred, and they usually worsen over time, particularly if smoking exposure continues. Signs and symptoms of COPD may include A. Shortness of breath, especially during physical activities. B. Wheezing. C. Chest tightness. D. A chronic cough that may produce mucus sputum that may be clear, white, yellow or greenish. E. Frequent respiratory infections. F. Lack of energy. G. Unintended weight loss in later stages. H. Swelling in ankles, feet or legs. Causes. The main cause of COPD in developed countries is tobacco smoking. In the developing world, COPD often occurs in people exposed to fumes from burning fuel for cooking and heating in poorly ventilated homes. Only some chronic smokers develop clinically apparent COPD, although many smokers with long smoking histories may develop reduced lung function. Some smokers develop less common lung conditions. They may be misdiagnosed as having COPD until a more thorough evaluation is performed. Risk factors. Risk factors for COPD include 1. Exposure to tobacco smoke. The most significant risk factor for COPD is long-term cigarette smoking. The more years you smoke and the more packs you smoke, the greater your risk. Pipe smokers, cigar smokers and marijuana smokers also may be at risk, as well as people exposed to large amounts of secondhand smoke. 2. People with asthma. Asthma, a chronic inflammatory airway disease, may be a risk factor for developing COPD. The combination of asthma and smoking increases the risk of COPD even more. 3. Occupational exposure to dusts and chemicals. Long-term exposure to chemical fumes, vapors and dusts in the workplace can irritate and inflame your lungs. 4. Exposure to fumes from burning fuel. In the developing world, people exposed to fumes from burning fuel for cooking and heating in poorly ventilated homes are at higher risk of developing COPD. 5. Genetics. The uncommon genetic disorder alpha-1 antitrypsin deficiency is the cause of some cases of COPD. Other genetic factors likely make certain smokers more susceptible to the disease. Treatments include A. Stopping smoking. If you have COPD and you smoke, this is the most important thing you can do. B. Inhalers and tablets, to help make breathing easier. C. Pulmonary rehabilitation, a specialized program of exercise and education. D. Surgery or a lung transplant, although this is only an option for a very small number of people. I hope that this video can educate you to reduce COPD in this world. Thanks for watching.